So the table of contents, I will have some introduction to environmental health, global scale, regional scale, and local scale, and from theory to practice. So you will see that I will present some parts of it today. Introduction to environmental health. Environmental health is a field of public health that addresses physical, chemical, biological, social, and psychosocial factors in the environment. Theory and practice of assessing, correcting, controlling, and preventing those factors in the environment that can adversely affect human health and future generations. And here is my question for this, for all of you. What do you know about environmental health?
I think environmental health is like more holistic than just like something exclusive like public health or like biological standards. So it combines like policy and it combines like science or STEM topics to affect like a greater approach to health.
Yes, yes. And remember, environmental health is a field, is one of the subfield in public health, but is, as you mentioned, is very dynamic, is very holistic in the sense that it addresses a wide range of issues. And sometimes what we know about environmental health might come from things that we have read in news on chemical stuff or biological, but we don't know that there are also other aspects of environmental health when it comes to social or psychosocial factors of the environment. What else?
I think about like air quality. I think about like water quality. Also think about like the physical environment, how safe it is for people to be around it.
Absolutely. Yes.
Stuff like air pollution, noise pollution, how it affects people physically and mentally. So
Right.
if you can't see the sky, then kind of a big issue, right? So
Right.
that's what I would think of when I hear environmental health.
And remember that even though environmental health tends to puts more emphasis on science and discoveries within scientific fields, at the end, there is always something to be translated to architecture and to design and to planning, right? So again, what I want you to see here is, again, the big elephant in the room. Even though, for example, in environmental health, we may not necessarily talk about design issues. I mean, the issues that they talk about are directly related to design and architecture and what we do here, what we do in our school. The whole aim of this field is to control and prevent environmental hazards and promote health and well-being. And it requires many different disciplines like epidemiology, toxicology, psychology, communication, urban planning, food science, law and ethics. So you can see that um, um, people from different fields are involved within research in the field of environmental health. And when it comes to defining environment, so we have physical environment, which is unaltered, like sunlight and radon gas, right? So the natural environment. And sometimes we also have altered environments. And it's important to see the difference between these two when we are talking about physical environment. Sometimes we are talking about, again, natural environment or altered environment in which there are some chemicals, radiation, biological products. It's just an example of this. And the third category, which is more kind of related to what all of you do, is the built environment, which is a result of human construction and its impacts. And systems approach and embraces complexity. It's actually the environmental health strategies are focused on upstream factors and downstream health impacts. And some of these kind of these factors are drive forces, pressure, state, exposure effects and actions. And this is actually and I will be talking about this a bit later, but here you can see actually this kind of cycle, moving from exposure, then the effects of exposure, then driving forces, how it's going to have an impact on economy, on society, on the politics, and then pressures when it comes to ecosystem and, for example, waste release, and then it's going to have an impact on the state, right? On the state of ecosystem. And then you can see that that also makes an impact on exposure. So that's why when you look at it, it's a series of factors kind of affecting each other. Ecology is kind of in the interaction of living things in their environments. And when it comes to the community ecology, social and ecological interactions, um, which and also their impact on human health. So we have ecology and we have community ecology and we have human ecology, and human ecology is more kind of about this kind of complex relationship between humans and their environments. And of course, that happens in different scales, in urban, rural, regional. And but I want you to be aware of these kind of different categories of ecology that we have and different layers in local, regional, and global, and they all affect each other. Another term that is relevant here is epidemiology, and all of you have heard this, is a study of distribution and determinants of health and disease in human populations. So what does it give us? The causal inference, meaning that we can determine whether a given exposure is associated with a given disease, and determine effectiveness of intervention in change of exposure and improved health outcomes or not. And Colette, can you come up with any examples of this?
I mean, I think the first thing that comes up is maybe just all of the research on vaccines at the beginning of the COVID-19 pandemic.
Mm-hmm.
And making sure that like testing it on different populations, and then based on that evidence, giving the population information on like how to proceed, like who gets a vaccine first based on the research, that sort of thing.
Absolutely. I think, yeah, the vaccine is a very good example. First, you need to test it. Then you need to see how effective it's going to be. And also, you need to consider the side effects in the whole process. And we have the environmental epidemiologists. Epidemiologists to judge whether a particular causal hypothesis is plausible. And whether something results in something else, or there is a kind of a correlation between these two. And when it comes to different types of epidemiological studies, we have the descriptive, in which we simply characterize a disease by factors such as age, sex, time, and geographic region. And any examples of this?
I mean, one thing that's been percolating since we've been talking has been the proposed correlation between leaded gas and violent crime, and the decrease in violent crime after lead was removed from gasoline.
Right. And this is actually the correlation one that we will be talking about later. And you're right. The descriptive one could be simply just talking about, let's say, Parkinson within a certain age group, gender, in a specific geographical location, right? But that level of specificity is really important in epidemiological studies, because that helps us see what could be the reason behind this, right? Because, for example, if you do the descriptive study first, and for example, you come up with these numbers and you see, oh, there's a huge kind of disparity when I compare context A. Let's say I'm in Riyadh in Saudi Arabia, and I compare the number of Alzheimer patients, I mean, the Alzheimer patients among women who are 70 years or older, 70 years or older, right? And you compare that number to the number of people, I mean, the same kind of group in the context of Baltimore, then sometimes it can start kind of helping you kind of come up with some conclusions, right? So the descriptive is really is important. So the correlational study is to examine correlation between some specific exposure and disease rates at the level of groups, and usually it happens at the level of groups rather than individuals.
Well, could it be something, for example, like increased rates of heart disease among middle-aged women and older because of undetermined factors?
It could be, yeah, it can be, yeah, absolutely. So, and then we have the analytical studies, which is, for example, let's say, is pesticides exposure associated with Parkinson's disease? And there are lots of examples of this, like, for example, this water crisis that we had in Flint, right, in Michigan, right? And there were lots of studies about, people dealing with certain health issues over there. And of course, lead is another good example, which resulted in some kind of meaningful changes in policies in the US. So in terms of the studies that we have, of course, we have clinical trials, which are totally randomized, and they are usually based on very rigorous scientific models, control experiments. So usually you have a treated and untreated variable. So that, I mean, because you need to always compare two groups of people and to see if certain things, I mean, certain environmental exposures actually have an impact on health or not. We have observational studies as well. And for example, there are some uncontrolled studies. And usually when big things happen, big events happen, sometimes there are some studies or there are some news coming out of these events that there have been some kind of health issue as a result of these kind of huge events. And of course, we have three principal designs. So you don't need to learn that because this is just too specific for you. But I think what's important is to know that we have observational studies. Environmental epidemiology study the role of exposures in the general environment, and the focus is environmental agents that large numbers of people are exposed to involuntarily. And environmental exposure contributes to epidemics or to endemic disease. And this is actually what we have studied actually a lot as part of the epidemic urbanism. So Professor Marcus Hendricks actually is one of our colleagues who works on environmental health. And he and his colleagues have been, for example, studying water, in different neighborhoods in Baltimore, to see, how environmental, how exposure to certain things is affecting the health of minorities in these neighborhoods in Baltimore. And of course, the most famous example of this, again, is the lead. And all the studies that were done on lead that resulted in making changes. And now there are very, very strict policies. And all of this movement happened because they could prove that, lead has very specific impacts. So it could be proven. And that could be done, that could be shown actually in many scientific studies. So the impacts of lead on memory, on hearing, on hearing, and heart issues even. Sometimes actually there are a couple of issues. One is sometimes we cannot measure everything, especially when you are dealing with certain communities or certain groups of people. It's hard to measure everything. Another issue is that in many cases, many of these environmental issues result actually in death. And again, a good example of this was COVID-19 in the beginning before the vaccine, right? So death was the result of COVID-19, and that was unfortunately very common across different parts of the world. The other part is actually the ecological impact that could be slightly invisible to us, that sometimes some elements of some chemical elements or some exposure may not have an impact on us in a direct way, but it may have an impact on the plants, on the animals, right? And eventually what we eat, what we interact with on a daily basis. Does it make sense what I'm talking about? Right? And Talha, so that part is also quite important to note that, and this makes the role of the scientist even more more complicated. And also it shows us that in addition to epidemiologists, they need to work with experts from other fields to see, to have a kind of an unbiased study of the impact of physical environment on health. An approach is to study interaction between humans and physical environment. One is, of course, risk assessment. I mean, what's the risk of something, you know, on certain populations? The public health assessment, the ecological assessment, again, the impact that the impact of something or some elements or some chemicals or whatever on ecology, again, an ecology in micro scale to macro scale, and the interaction analysis and also systems analysis. So these are different approaches that we have. The four-step risk assessment process is quite interesting. The first one is dose response assessment. The second one is exposure assessment. And these two actually result in risk characterization. So this is how systematic actually they come up with risk assessment. For example, in the beginning, you ask what health problems are caused by the pollutant. So you ask this question, and then you may focus on a specific type of pollutant. And then you ask, what are the health problems at different exposures? For example, you may study the impact of certain pollutants on the health of certain populations. But again, we talk about health problems, but when it comes to the risk assessment, it could be very, very specific. It could be focused on, for example, heart disease, on certain types of cancers, et cetera, et cetera. And then, and which has to do with non-toxic, toxic, and very toxic. And then when it comes to exposure assessment, you ask, how much of the pollutant are people exposed to during a specific time period? How many people are exposed? So you ask these questions. And at the end, for example, the maps that you see that have to do with, for example, air pollution, they are all based on this question that the public health experts, environmental health experts ask, right? For example, let's say when you look at this map that shows the distribution of, I mean, not the distribution, but the amount of air pollution in different parts of the world. And then you compare it to another map, a similar map that shows the spread of certain disease, and you find so many similarities, then you can see that, oh, okay, so then there must be some kind of correlation between air pollution and that specific issue. Let's say, for example, heart diseases. And the last one is risk characterization. What's the extra risk of health problems in the exposed population? And again, there are lots of studies on this in the field of environmental health. So the public health assessment includes data on actual exposure in a community. So you may focus on one community or different communities in different parts of the world, the risk to large numbers of individual ecological risk assessment, and investigation of risk to plants and animals, and not just humans. And as I mentioned, this is mainly because this issue of indirect impact is really important, the study of these indirect impacts. But also, I want to remind you that all these things that we are talking about, they started in some new studies and some new literature that was kind of the genesis of what we call the environmental justice these days. So in terms of the systems analysis approach, not all risks for environmental disease require the same exposure. So we have high level or low level, long term or short term. And can you come up with examples of this? I mean, again, imaginary examples. Let's say there is an environmental exposure to something, right? So let's say a certain community are exposed to, for example, lead, right? So can you give us a lead specific example here? And you may have actually very, I mean, a specific case here could be houses that were designed and constructed in the city of Baltimore in 1960s, for example, right? And people who live there, and you can go there and you can simply just measure the amount of lead there, right? And then you can compare it to something that was designed in, let's say, 1980, in which, I mean, the amount of lead is very, very, very limited because, I mean, after I think 76, they started kind of enforcing these policies, right? So you compare a high level and low level, right? How about long term and short term? Because it's not just about high level and low level. Sometimes you living in a low lead house for 3 years may cause more harm than you living in a high lead house, a high level lead house for for 2 days. Does it make sense?
That just kind of reminded me, I was living in Florida at the time and I was getting a lot of headaches. I was feeling really sick. And then we found out that there was a ton of mold in my bathroom. And we'd been living there for several years at that point, and I had been dealing with health issues pretty much that entire time. So once we had that remediation, those kind of started to lessen. So that's I think like
Absolutely.
a low versus high.
And just, I mean, I can give you an example, a real-time example. My house is literally probably half a mile away from a big Wi-Fi tower, right? And I just recently discovered this. So I have been reading lots of studies to see if, I mean, to understand the negative impacts of Wi-Fi, on physical health, mental health, emotional health, social health, all types of health that we were talking about here. But again, what I'm worried about is that we have high level of Wi-Fi in my house, and we have plans to live there for long term, right? So if I was living there probably for 3 weeks, I would not have been worried too much. And also, I think, I mean, one thing that we all realize is that one of the biggest dilemmas in the study of environmental health is, in the context of the US especially, are all these lobbies that exist in the Congress, right? For example, let's say I realized that many big kind of communication companies like T-Mobile and AT&T have been kind of funding their own research as a way of kind of proving that there is no impact. There is no, Wi-Fi does not have any negative impact. And remember that this is not a new story. This was done before by many other companies in the context of US. Like, for example, cigarette companies trying to say that, I mean, tobacco companies trying to tell you that, you know, there is nothing wrong with having tobacco. There is no correlation between, you know, heart diseases and smoking, right? So you also realize that, you know, there are some kind of political dilemmas when it comes to the systems analysis approach. Most of you already know what is GIS, but GIS actually played a very, very important role in transforming the whole field of environmental health, mainly because nowadays, for example, when you are studying a context, you can just go online and you can kind of narrow down your search based on zip code, based on the county, right? Based on the region that you are working on. And what does it mean? It means that if you can get some numbers of, for example, exposure to certain issues or certain chemicals, right? And then you study the spread of certain diseases, things become much easier for you to measure. So that's why GIS started kind of fully transforming the field of environmental health. So, and of course, you know, GIS has its own kind of problems. One of the biggest problems of GIS is that GIS sometimes is very broad, right? And does not give you an idea about the distribution, I mean, the complexities of different communities within a certain zip code, within a certain region. And that's actually one of the biggest problems. And another issue is that usually the studies based on GIS, they tend to be observational. That's why many researchers or many big projects actually start with the GIS analysis first. Once they have some kind of observational support, then they lead to experimental studies, right? For example, you say that we did these studies that when you compare the air pollution, for example, in this area versus that area, it shows this. Now we need to make it more specific, and now we need to do some experimental studies to prove that further. And toxicology, most of you are familiar, to some extent, are familiar with toxicology, which examines the adverse effects of chemicals on biological systems. And again, remember that we are talking about biological system as a in holistic sense. And we are talking about toxins, which is chemicals of natural origin, and toxicants, chemicals that result from synthetic process. And why does it matter? And I keep talking about, I keep talking about the relevance of these topics to the work that you are doing in architecture school, because many of you may end up choosing design projects that have to do with sites that are not totally clean, and there's a history of toxicity there. And that's why it's really important for you to study that, to see how it's going to make an impact on what you are designing and what kind of preventative measures you should take in your design projects. And a very good example of this, for example, how to provide safe drinking water to a community, you know, to understand both adverse effects of organisms found in water, adverse effects of chemicals used to kill organisms. And in this case, the intervention is to use chlor to reduce microbiological contamination in water, right? So sometimes remember that you may have something, right? So you may have some issues there, right? But even the solution may result in some other problems. And this is also really important. And the last thing actually that I want to mention here is environmental justice, which is very relevant to what we are doing in this class. And at least the presentation that Mansi will be presenting today is going to be very relevant to this topic. And because environmental justice addresses the disproportionate impact of environmental hazards on vulnerable groups, right? Kids, minorities, female, anyone who is vulnerable. And the meaning of vulnerability is very different from context A to context B. Communities of color and the poor, they are more vulnerable, sometimes linguistically isolated, and immigrant groups are more vulnerable, and being very young or very old or disabled. Environmental justice promotes access to environmental, social, and economic assets such as good air quality, safe drinking water, green space, and public transportation. And I'm ending it here mainly because there is this environmental justice aspect that that is the main overlap between what many of you are doing in your thesis projects, in your architectural projects, and environmental health. Because at the end of the day, you want to make sure that the project that you are designing is accessible to everyone, right? Especially more kind of vulnerable communities. Again, I want you to pay close attention to the overlap between environmental health and the work that you are doing in your other classes, especially in the studio projects, in your planning projects. Colette, you are the only public health person here, so what are your thoughts on environmental health?
Yeah, I feel like I always wrap it around to my own kind of research interest, and that's like food deserts. I've been thinking a lot during this past hour of just how environmental health is, it seems like so beyond the individual control. So you need
Yes.
these like upper level projects and efforts, whether it's like policy or even at the community level, to help people on the individual level, because it's just so beyond, for example, someone's control to like build a grocery store. So I've just been thinking a lot about how it's just outside of individual control, and how interventions need to kind of really come from like the top down, or at least be maybe, started from the bottom for ideas, but in terms of like power, definitely needs to come from higher up.
But I'm glad that you are talking about this, because the first step is to empower the community and give them a voice so that they can tell you what's wrong, what's not working. And again, I keep referring to Flint, because Flint is a very good example, because the community was very outspoken about what was happening there. Just imagine that you were dealing with people who were silent, and they were not just complaining, and they were just drinking the water, right? It's going to be it could be a very different case. Of course, Flint is a very good example. At the same time, a very obvious one, because it's drinking water, so you can easily see, and there are things that you can just order on Amazon to see how healthy your water is. So it's not, but sometimes the air quality within our buildings could be very low, and we may not be necessarily aware of this, right? Because not all of us have devices that we can use to measure air quality in our houses. And guess what? Sometimes, even if we do, we don't have any other choices. Like, for example, as I mentioned, my house is just close to a Wi-Fi tower. Am I gonna just move somewhere else because there's a Wi-Fi tower there? Probably not, because more most likely wherever I go, I'm gonna be a mile or 2 miles away from a Wi-Fi tower anyway. But I think that advocacy is important, because the advocacy results in research, and research results in policy, right? Because the moment that you have research, and I'm mentioning research because FDA actually is the one agency that is supposed to be a big kind of advocate for people. Both FDA and NIH actually, in the context of US, they play an important role. Right?
Colette's point to the food deserts kind of made me think about like the resurgence of urban gardens and urban farms.
Yes.
And how communities, I was looking at some articles about communities in Baltimore being concerned about heavy metals and contaminants in their soil, which kind of led to this citywide effort to do widespread testing. And then they found that the soil was actually within safe levels and that people can feel good about being urban growers and buying food from food markets and other
Yes.
local sources as opposed to relying on industrial farms. So I think that was one of those, it started at the bottom with the individuals who really wanted to help their communities, and then finally got it to the state or city level rather, to actually do something about it.
Absolutely. Hernan, that's a very good point.
Yeah, it was interesting that you started to mention power and how that can factor into how people will speak out about the issues in their environment. I think it's a little trickier when it comes to housing because if you're looking at like physical aspects of your environment, then you might have to bring this up with a landlord or a tenant. Or,
Sorry, can you repeat? We couldn't hear.
yeah, no, I was going to say
The
that
last point, the last sentence.
you'd have to bring it up with someone like a landlord or a tenant. Whereas if you're talking about like water quality in the whole city, you know who you're going to talk to and you're going to bring it up to a big audience. So
That's very
you
true.
have to go through more loops, more hoops to fix your built environment before you can actually like make it a huge concern.
Right. But also that tells you that, I mean, again, that tells you something about environmental justice, right? That all of these environmental issues, they tend to affect the poor, the most vulnerable ones, right? The ones who may not have a voice, but it's also very important to kind of to be their advocate and give them a voice and hear them. But yeah, these are very good examples. And sometimes remember that you may have simply people who are living in an unhealthy environment, but because, for example, they cannot afford um, kind of higher rent, they cannot move to other places, right? So that's why they don't have many options. It's unhealthy anyway. But the good thing is that there is some level of kind of protection when it comes to laws, environmental laws, and for example, let's say specifically talking about landlord versus tenant. So that's more kind of manageable than, as you said, dealing with bigger scale issues when it comes to the city.